point. So allow me to take us through shortly what the conference entails in terms of the theme and 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 how we plan for it. It's the 6th National Palliative Care Conference. The theme is palliative care through the inclusivity lens. And what does that mean? Has anyone here taken care of a person who was sick? Yes, I believe the answer is yes. Are there things that you've done to, feel part of the care team? Yes. Do you have people that provide kind of supportive aspects to care, and you'd love or to hear from them what they did or what their opinions are? Yes. And so the inclusivity lens is looking at the holistic approach to the different aspects of care, covering or else looking at the client in the center of care and the many people around that care client or that patient who contribute to care aspects to that client. So it could be the patient, caregivers, community, policymakers, and the many aspects that are undertaken in terms of patient care. And I would request everybody to mute their mics unless those who are speaking kindly, so that we don't interrupt the session. So I was saying it's the inclusivity in terms of givers of care, recipients of care, policymakers, other sectors that are involved in supportive aspects to care. And so this is a conference for everyone. This is a conference for the different people, those who are in decision making, those who are in support aspects, so are in allied position, even the general public, because everybody is involved in care. We host it on the 15th to the 17th of November in Kisumu, and I would encourage all of us to visit the conference website, which is shown below, kehpca.org/conference, to get now further details where we've posted almost every information that you would ever require. And again, it has our contacts and all that. So the conference has this main theme, palliative care through inclusivity lens, and hence, therefore, seeks to present palliative care through the lens of equity and inclusivity. At the end of the day, we want to encourage access to palliative care, and we have these 4 W's that are our guide in terms of unpacking inclusivity. So W number 1 is whoever needs palliative care. Is it a patient? Is it a caregiver? Is it somebody with tough conditions? Is it somebody facing difficult non-communicable disease? Is it somebody with dementia? Is it someone, who requires counseling? So whoever needs it, we should be able to advocate for access to that care. Is it somebody in Kakuma, in a marginalized place? So it's about whoever. So anybody that requires palliative care should be able to be viewed from the lens of inclusivity. That's about the theme. And so I pose a question in terms of anybody, or do you think of anyone in Kenya who requires palliative care or even outside of the country? And are they able to receive it? What would you do? What would you want to be written about? Or what would you wish to be said for that access to that patient or to that person? That's a track, or it's a discussion that you can bring on board during the conference. W number 2 is whenever. And so it's in terms of in whichever state or in whatever place. So through whichever means that we can unpack palliative care to be provided. W number 3 is wherever. And it talks about timing and at the same time place. And then finally, it's about whoever is able to provide that care. And this unpacks the whole group of providers of care. This could be healthcare workers, non-healthcare workers, the general population, and anybody who cares. Because there is a statement said, if you care, you'll never be wrong. So for being a scientific conference, please, you should not be scared by some of the terminologies that we use. We've just packaged the conference into 2 tracks, so that as we draw the program, we are well guided. And so track number 1 is about equitable access to palliative care through inclusivity, just like I said previously. So equitable access would cover different sub-themes or sub-tracks to speak to access from diagnosis across the cure trajectory of diseases when people are undertaking or receiving active treatment and management through the journey to rehabilitation, end-of-life care, bereavement care and support, and also to cover family support systems and survivorship. So it's looking at access from that perspective. It's about from the time of diagnosis of a life-threatening condition is done all through to the support given until survivorship. So that track number 1 would be looking at that in terms of equitable access. And so the sub-themes under this, we have 4 sub-themes, just to make so that you may think about when you want to write an abstract, where to place your abstract from. I just picked a few examples in terms of subtrack 1, which talks about inclusivity of beneficiaries of care. So whoever is in need of care, regardless of their diagnosis, should be viewed from that lens, and this would include marginalized refugee groups, the elderly, the perinatal pediatric care, the youth, persons with disability, persons with psychiatric conditions, non-communicable diseases, infectious and non-infectious conditions, congenital and acquired conditions, including also mental health conditions. And the list is really long. I just wanted to post this as examples of inclusivity from subtract 1. Subtract 2 talks about excuse me, inclusivity for care providers in palliative care. And this is where we include the healthcare workers and include the multidisciplinary teams, doctors, nurses, clinical officers, physiotherapists, pharmacists, nurses. There are so many. I might not be able to list everyone, but that is where they are placed. Caregivers, either at home or trained caregivers, community volunteers and community extension workers, general community members. And at the end of the day, we need to think around patient-centered care. So think about a paper or writing an opinion or highlighting an argument or evidence that being a caregiver and what you did would help and support a patient from a patient care perspective. That's the lens of inclusivity in terms of care providers. Subtract number 3 is inclusivity in terms of timing. And this covers whenever the patient needs that care across the disease trajectory, like I said, from diagnosis or across. And so it could be a paper about an experience or a case presentation that you met a patient at time X and your interventions at that point enabled improvement of quality of life. So that will be a paper on this subtrack. And so I believe by now we are starting to see how it is easy to write such kind of papers. Track number 4 is inclusivity in terms of setting. And this is talking about whenever the patient is. So different settings and models of palliative care provision could be utilized to meet the needs of the patient to achieve universal health coverage. So is it palliative care in the village in terms of place? How does it differ from palliative care in an institution? Do you want to write about institutional care, that you kept a patient in a ward for 3 months and what happened as a case scenario? Or do you want to present a paper on data collected for an institution over a period of time for X kind of patient? So interrogating your thoughts from the perspective of where the patient is and how that lens would look at if we were able to focus closer in terms of the whenever the patient is. That's track number 1. Track number 2 is looking at a bigger umbrella in terms of equitable and inclusive healthcare system for palliative care integration. Many words, many words in English. But basically, this would be focusing on inclusivity of palliative care in all systems and by all players. So the subtracts under this track 2 are 3. 1 is on systems and supporting players. These would be government, non-government institutions, institutions that undertake work in climate and climate change effects and what that would mean in terms of palliative care, environmental hazards. We recently just had the pandemic, COVID, and the whole discussion around vaccines, technology, and all that. Subtract 2 is on policies, laws, guidelines, frameworks, legislation basically in palliative care, and how the implementation of the same would affect access. So focusing again on policies. And number 3 is financial or financing models for palliative care. We have seen in our context many times people doing harambes, fundraisers, WhatsApp groups, to support certain initiatives. Do you have a case scenario of great success or how that affects or has an impact in terms of palliative care provision? So that's unpacking the conference. I just thought it was important for us to highlight what we are thinking about. And so now, Dr. Robai, who is a student undertaking masters in population health, has been a researcher in palliative care for many years, has worked with Kehpca on many research components, is with us. And I want to hand over the platform to her so that she may take us through the next session. If you have any questions, kindly hold them until the end, and then we'll have a bit of interaction towards the end. Thank you very much. Over to you, Dr. Robai.
Thank you very much, David, and thank you for that wonderful introduction to the topic that we are going to discuss today. Yes, I'm a student, and I also do consultancy work at the same time in research, specifically research in cancer and palliative care. I'd like to not take a lot of time. I'll just yes, David, you can start sharing my slides if that's okay from your end. But I think I can also share from my side. Let me try sharing from my side. Are you able to see my slides?
Not yet, and I would again kindly request that we all mute our mics. Jen. Okay, Robai, go ahead.
Are you able to see my slide?
Not yet.
Okay, then probably we'll go with the other option of you sharing my slides, please.
Okay.
Allow me to turn off my camera just because of the network issues.
I hope it's now visible, Robai, from your end.
Yeah. Yes, it is. Thank you. Is that visible to everybody? Okay.
Yes.
So yes, so David has introduced the conference, and he's done quite a lot of groundwork for me. So some of the things that he has talked about, I will just be able to go over them briefly. So next slide, please, David. Yes, so this is the 6th Kehpca National Palliative Care Conference, and it will be in Kisumu, just what David said, from Wednesday the 15th to Friday the 17th of November at Kehpca Premier Hotel. Next slide. Has it moved? Are we on the second slide? Third slide?
Yes, that's the third slide.
Okay, the third slide is just a picture of the lobby, and okay, so are we on the fourth slide now? Yes?
Yes.
Okay, so we need to understand, first of all, what the objectives of the 2023 Kehpca conference is all about. And as David mentioned, it is to enhance learning and knowledge translation in palliative care and other related fields. The conference seeks to present palliative care through the lenses of equity and inclusivity throughout the life course. In the subsequent slides, we are going to discuss more about equity and inclusivity, just to be able to understand exactly what that means in this context. And the conference, just before that, please, David. The conference seeks to encourage access to palliative care by whoever needs it. David has gone through this quite well, provided whenever it is needed, wherever the patient is, by whoever is able to provide the care. Next slide. So let's differentiate between equity so that we can be able to understand what it means exactly by equity and equality. So this picture here, I really like it because it actually shows what we mean when we are talking about equality. Sometimes people say we want equal opportunities, but the other picture on the right is about equity. So the difference is that in equality, you are provided with the same kind of, let me call it a rostrum of sorts for people to be able to watch the match. So that is equal. So you can see the person on the wheelchair is not even able to climb up to that rostrum, and the little girl is struggling to see over, and the gentleman has access. That is what equality is all about. And when it comes to equity, the aim is to get people to a level where they're all able to access the service. In this case, we are talking about palliative care. Everyone should be able to access the service wherever they are and whenever they need it. So the gentleman is able to watch the match. The little girl has 2 rostrums and she's able to watch comfortably. And the lady, I think she's a lady on the wheelchair, not only was given the rostrums, but even kind of like a ladder to get to that place where she can also be able to enjoy the match or the service in this case. So that is equity. Next slide, please. And we talk about inclusivity. Here is where all of us are involved. So the beneficiaries of the palliative care are involved. We are looking at timing of palliative care, the setting of palliative care provision, and involves all stakeholders. Next slide, please. So what do we want to achieve when we go for a conference like this one? Apart from where you present your abstract and you are able to attend and also participate, we are looking at being able to disseminate the research that we have carried out for those who carry out research. And the conference will provide a platform for researchers and scholars to present their latest findings and research outcomes. This allows them to share their work with a broader audience and receive feedback and suggestions from peers. Again, there'll be knowledge exchange and collaboration. The conference will facilitate the exchange of ideas, methodologies, and knowledge among participants. Individuals from different institutions and backgrounds can interact. You're able to discuss your work, and you can be able to foster collaborations for future work. So at the conference, there'll also be networking. The conference will provide opportunities for individuals to network and establish connections with colleagues and experts in their field. Building professional relationships can lead to future collaborations, mentoring opportunities, and access to resources and funding. So you really don't know who you'll meet there, and all these opportunities are available. Next slide, please. It also allows you for professional development. The conference will include workshops, discussions. There'll be keynote presentations by renowned experts. These sessions aim to enhance the skills and knowledge of attendees, allowing them to stay updated with the latest advancements in their field and develop professionally. Also, there's the awareness of emerging trends. Attending the conference will help you stay up to date with the latest developments and future directions in your area of work or study. There'll also be inspiration and motivation. This conference will provide an environment that fosters inspiration and motivation to keep you doing what you are best at, or even reignite your enthusiasms. So this basically, I was just going through it so that I can highlight why it is important to attend a conference such as this. And at the same time, if you are able to provide an abstract and it is accepted, you are participating at a higher level where you are also disseminating knowledge. So others will be able to learn from you, learn from your experiences, and learn from research work or learn from projects that you've carried out. There's always something that you have gone through, something that you have done that is unique, something that maybe like an innovation of sorts, and you can actually be able to present this in form of an abstract, and you'll have a platform, an audience to discuss this with and talk about it. And you know, in science or any field, let me say, we are always building up on previous knowledge. So if you know something or you found out something and you are not able to disseminate it or share it with somebody else, it just remains what it is. But when we keep on building on each other's ideas, then we keep on building the profession, keep on growing the knowledge, and the outcomes for our patients will be even better. So we have to pool all this information, and Kehpca has provided such a platform where all of us can submit abstracts. And when we get there, we are able to share what we have. And not only with the abstract, but you'll meet other people like-minded, others who have gone, who are more knowledgeable than ourselves. And we'll find others who need to learn from ourselves. And we exchange ideas, exchange knowledge. So it's important that we all endeavor to attend this conference and submit abstracts of what we have learned ourselves so that we can be able to share that information. Next slide, please. David, next slide. So what are the key, okay, yes, thank you. What are the key steps to preparing an abstract? Okay, first of all, we have to understand the conference requirements. And remember, David has gone through this quite a bit about the tracts that are there. There are 2 tracts, and there are several sub-tracts within those 2 tracts. So we need to familiarize ourselves with the conference guidelines and requirements for abstract submission. So we need to pay attention to the specified format, word count, limitations, and the specific tracts, themes, or topics the conference is focusing on. So when we develop our abstracts, we need to place them under the tract that is relevant for whatever we want to share. Then we need to define the scope and objective. We need to clearly define the scope and objective of the work that we want to present. If it is in research, we are looking at what problem or question do we want to address? What are the main goals and outcomes of what we want to present, so that we can summarize this information concisely into our abstracts. And then we need to structure the abstract. Usually, the abstract is in a, the conference organizers will provide key areas where we are supposed to submit information within the abstract. And the sections can be, for instance, for this case, we have the background, we have the aims, we have the methods, results, and the conclusion. And we need to organize our abstract according to this. We need to make sure that we include the essential information in each section. So we need to be very deliberate about this for our abstracts to be able to go through. Next slide, please. Okay, so we have the first track and the second track. David went through this quite well and even talked about the subtracts for each of the 2 main tracks. So again, you see these tracks are really talking about equitability, equitable, and also inclusivity. Both of them have that word. So remember how I was defining the equitable. So when you present your abstract, think about equitable. Think about inclusivity. And then look at the subtracts and see where your abstract fits in best. Next. Okay, so we have different types of abstracts that can be submitted. For researchers, we may submit our abstracts in the abstracts of empirical studies, secondary analysis, or systematic reviews. So those are research-based, and we'll need them broken down into background, aims, methods, results, conclusion, or discussion. And then we have other abstracts. These are non-empirical work. For example, if you have a project that you're working on, it's not necessarily a research project, or it's just about the program that you run and you want to report something that is interesting, that is new, something that you have observed. You would even want to present, how you established a hospice somewhere. What are the challenges you went through? How did you overcome them? So this is the kind of information that people at the conference would like to get to know. It's never easy to start a palliative care unit. So if you are involved in starting a palliative care unit, it would be interesting to tell others how you went about it. And people keep learning and learning from each other. So everybody will fit in somewhere. So it doesn't have to be research. It can also be a project that you are running, or a palliative care unit you established, or even organizing a meeting somewhere where you are, talking to people about palliative care, lessons learned, anything. I'm sure everybody who's listening to me can relate to something that they would really want to talk to people about, something that they have experienced. So everybody should be able to submit an abstract, just talking about what you've gone through. I'm sure some of us have been in the field for a very, very long time, and we have had experiences. We've learned so many things. We would want to share this information with people who are just starting, people who are just joining the palliative care field. So I think everybody has something to tell somebody. So this is the place where we can actually submit abstracts and be able to present this at the conference. Next slide, please. So then let us look at the breakdown of what is required of us. If I may just ask, I don't know, is the chat active now, or can we, maybe some people will just volunteer to answer this. We have a background, we have an aim, we have methods, we have results, we have conclusions. How do you start writing an abstract? How would you start writing? Anybody to volunteer an answer? Just tell us which part of the abstract can we start with?
Can I?
Yes, please, Emmanuel.
I think the first part on the abstract is the title.
Yes, there is the title. Sorry, this slide doesn't have the title. I didn't put it, but the one that I would have projected would have had it. Yes, there's the title as well. So Emmanuel, you'll start with the title. Anybody else? Anybody else? Writing is never easy, by the way, so any answer will work. People have different ways of writing, so any answer will work. Emmanuel will start with the title. Okay, maybe let me just give an example of how I usually go about my writing. When I start writing, I start from anywhere, the one that comes to my mind first. Because I know the whole project, I know from the beginning till the end, I know what I want to say, but I really want to write it. I want to write it, but I don't know where to start. So I'll start from the one that comes to my mind first, the easier one for me at that point in time. So I could even start with the conclusion and then pick the other part and write about it. Okay, I write about the conclusion because I know how it concluded. And then I ask myself, so how did I get to that conclusion? Then I write the method. And then the results, I figure out how I'm going to write the results. And sometimes I get the title last. So you just start. The idea is just to start. Start from wherever, start from whichever works, but start writing. Okay. So I can actually start from anywhere because I know it from the beginning to the end. It's not like a research work where you have already the background, the aim, and the methods. So when you're still collecting the data, maybe you're writing the methods and the aims. But here is an abstract. It's something that is already accomplished. So it's in your mind, but how do you start writing? Start from whichever place that you feel comfortable with. The idea is to just start writing. Okay, so you can start from whichever point that you want to get to. So the title part, the title should be very clear and concise. It's the title that will make people want to look at the next, what else you've written in the abstract. So the abstract should be very clear and just tell people a summary of what is within the abstract. So it needs to be very clear and concise. And usually the conference organizers will tell you how long the title should be, how many words, how many characters. So you have to adhere to that as well. Then you have the background. So you need to provide a brief context of your work, highlight the importance of the problem or the question you're addressing, and explain why it is relevant to the field. So you just give a good background on what you want to share with others. Then the aim. You provide a broad statement indicating the general purpose of your project. Okay. Then in the method section, you describe the methodology, or if it's an experiment, the experimental design that you used to carry out your work. If it is a project like setting up a palliative care unit, how did you go about it? The methodology you used. And if it is research, you need to talk about the sample size, the data collection methods, and how you analyzed the data. Then in research, you'll have a section for the results. You summarize the main findings and outcomes of your work. You focus on the most significant results or observations and present them in a clear and concise manner. Then you conclude. So you state the implications and significance of your outputs or findings, explain how your work contributes to the existing knowledge in the field, and highlight any potential application or future direction. So you again, you tell people what else would you recommend that they follow up from your research. So it doesn't end there. You always tell people what else do you recommend should be done in following up to what you have found. Next slide, please. So do we have any questions up to there? Any questions?
Good evening.
Good evening.
My name is Josephine from Kisi.
Yes, Josephine.
I want to ask, you said you can start from anywhere.
Yes.
And later now you rearrange your work according to the format you are given first. According
Exactly.
to the title, then background.
Exactly.
Okay.
Yes. So whichever, you know, you can think about it. Maybe you are just you are at you know, you are doing something else, then an idea just comes to your mind. You just write it down the way your thoughts come, the way the thoughts come to your mind. Just write it, and then from there you keep on building on it, and then you rearrange it the way the organizers want it. Because when the organizers read it, or when the readers look at it, they want to see it in this systematic manner. But as we all know, the ideas don't come at once to our own minds. So you just put down all your ideas, and then you will rearrange that when it comes to now organizing it for you to be able to submit the abstract.
Thank you.
Any other question? Do we all have an idea, something that we know about, you know, something that we have learned, our experiences? Just think about that unique something that you came across, or you did, or how you helped a patient in a situation that is not very common that you'd like to share at this conference, you know. And palliative care is about providing it wherever it is needed, whenever. So you are in a situation that is different from many other situations, and you actually managed to do something about that situation and turned it around, and the patient was happy, the family was happy. You know, those kind of things, your experiences. You know, palliative care spreads across very many disciplines. So we might even have people who have had cases like in the field of law, cases that have things to do with palliative care. Would you like to share that kind of information at the conference? Put it down in an abstract, present it to the organizers, and you're invited to speak about it so that other people can be able to just learn from you, you know, share an experience. It might be used by somebody else somewhere else, and not just in Kenya, but participants have been invited from all over the world. So they'll also learn from here, and we can also learn from them when they come, when we attend the conference. Okay. So I have an example here of an abstract. And this is, I just chose this one because it's just simple. It's understandable by people from different backgrounds. So the title is Smartphone-Based Telemedicine Service as an Acceptable Model of Care for Cancer Patients in Resource-Limited Settings During COVID-19 Pandemic. This was an observational study. So the person who wrote this this abstract put in a title. When you read it, you almost understand what else to expect. So in terms of the background, they said that the COVID-19 pandemic hampered palliative care services due to the policies of nationwide lockdown, social distancing, and patient triaging. Telemedicine can be a possible solution to overcome the hurdles of providing holistic care to cancer patients by minimizing the visit of patients to the healthcare facility. Okay. So now coming to the aim. So the aim, remember, it was just a broad explanation on what the project is all about. The objective of the study was to evaluate and assess the feasibility of telemedicine as a tool to provide palliative care during the COVID-19 pandemic in resource-limited settings. I'm sure all of us relate to this. It looks like just something that also happened here in Kenya. And now this is somebody from India who is reporting on it. We need to see, does it apply to us? You know, I mean, it's interesting. We also want to know what happened in India. Is it the same as it was when it was here? We know we had lockdowns, we had social distancing and all those things. So what happens? Okay, so this individual goes on to write the design and the participants. It was a retrospective study. A retrospective study was conducted to analyze the telemedicine service from 25th of March 2020 to 30th of June 2020. Patients who availed the teleconsultation services during this period were recruited. A smartphone-based 24/7 model for conducting audiovisual consultations was created whereby patients could interact with a trained palliative medicine physician. The study explored the reason for teleconsultation, main barriers for hospital visit, and patient satisfaction. The results: out of the 547 patients, 462, which is about 84%, utilized voice calling service. The major reason for not visiting the hospital was issues with transportation, 48%, followed by fear of contracting COVID, 37%. The majority of the calls, 63%, were regarding uncontrolled symptoms related to primary disease. 402, that is 73% of the patients, were very satisfied. They were satisfied with that telemedicine service. 399, that's 72%, about 73%, decided to use telemedicine in future as well. So how about at your hospice? How about at your palliative care unit? Did this happen? Do you have some numbers? Can you calculate those numbers and see whether you get the same satisfaction like it was in India? That is how research goes. Somebody else can pick this methodology and just carry it out in a different setting to see whether people who need palliative care in Kenya will also appreciate this kind of service just the same way the people in India did. Then in conclusion, telemedicine is a helpful tool to provide integrated palliative care to cancer patients who are unable to visit hospitals regularly. This was observed to be especially useful during the pandemic in a resource-limited setting. So if you have an abstract like this, and you share this information with others, others will pick it up. Others will compare with what they went through. So this is the kind of information that can be shared at a conference like this one. So this is just one area, telemedicine. There are so many other things that can be shared at the conference. Just think about them, some experiences that you've had. Maybe even now you have some data somewhere. Just do some analysis of that data, write an abstract and present it to the conference organizers. And you'll be invited to be able to present your work at this conference in Kisumu. Next slide, please. So this is another example. This is about what are patients' motives for requesting euthanasia, a cross-sectional survey among attending physicians. Again, the person who wrote this abstract breaks it down into a background, an aim, methods, results, conclusion. So just by figuring out what you want to share with others, you can start writing about it. And then in the process, break it down into these categories. Write it well, clearly, concisely. Don't use a lot of jargon. Just write it nicely and present it as an abstract for consideration so that you can be able to present it at the conference that is upcoming. Share your knowledge, share your ideas, even different methods of doing things. People learn a lot during conferences. Next slide, please. Yeah, that's just another example, and I know I have another example 4. Let's go to the next slide after example 4. Okay, so this is just as a summary. Next. Yes, this is just a summary. So the idea is follow the submission guidelines. There are quite a number of guidelines on the portal, on the website. So read through them carefully, follow them carefully, and then use clear and concise language. Write your abstract using clear, concise, and jargon-free language. Highlight the key points, emphasize the most important aspects, and then edit and proofread. Ensure there's clarity, accuracy, and coherence. Let it flow nicely, and you can even share it with your colleagues so that they can read it. And if there's anything that you can edit it so that by the time you submit it, even the reviewers on the other end will be happy with it, and it will be accepted for presentation. Next. Well, that's the end. So thank you very much. If you have any question, you can ask me at this point. And yes, best wishes with your abstract submission.
Madam, I have a question.
Great.
Yes, yes, please.
That was
Yeah, I wanted to find out.
yes.
Okay, I joined in a bit late and I saw those tracks that were being shown. So I was wondering, for example, if you want to talk about palliative care, the inclusivity of palliative care among people with special needs or people with conditions or across the spectrum. So I was wondering, would you just pick all of those, or can you focus on one or two? For example, can I focus on people who are marginalized, like people living in the refugee camps? Or do I have to include also people maybe with the chronic renal failure, people with other conditions? Or are you allowed to pick on one condition?
Okay. Usually, it is best when you make your presentation as simple as possible. So it really depends on what you want to share with others about those particular conditions. So if you have something about the special needs population, and you want to emphasize on something about special needs population, so just write an abstract about those the special needs population. But sometimes you might be talking about something that cuts across different populations. But whatever it is that cuts across is like the same thought process, you know. So that you don't have a very a lot of information put in one abstract. You understand? So if you make it as simple
Yes.
as it gets, then people are able to pick up just that one thing, and you can be able to have enough time to present it. Because I think you are given about 8 to 10 minutes, and then people can ask you questions for another 1 or 2 minutes. So there isn't much time to cover a lot of things in one abstract. But there is no limit to the number of abstracts.
Did we
Thank
lose
you.
Robai?
It's understood.
Yeah, as she comes back. Thank you, Justine. Yes, so it's
Yeah,
clarified and
sorry, I dropped out. There's no limit to the number of abstracts that you can submit. So if you have many things to talk about, just present those abstracts, and the organizers will organize that accordingly, so that you can present even in one track, and then you go to the another track and present something else different. So I don't think there's a limit. It can be organized by the conference organizers on how you'll present, so that there's no clash.
great. That's well. I see the hand from Emmanuel. Emmanuel, go ahead, unmute and Makanya.
Thank you. I have two questions. The first question is, after submitting our abstracts, are we going to get support in terms of preparing the presentations? Like, is there a team that will look at our presentations, like the PowerPoints, and advise whether it meets the set criteria? Number two, maybe this goes to David. Is there any incentive, like for any of us whose abstract is selected, in terms of registration and all that? Thank you.
Robert, do you want to handle the first bit, or do I handle the two?
I think you'd handle the two.
Okay.
Yes, because I'm sure there are people who may just need somebody to review their presentation just to see how it goes. And again, it's not just limited to the conference organizers, but you can share your slides or your presentation with colleagues, who can have a look and just give their input. And then because it's sort of like your idea and how you present it. So it's not so much on the other side, whether it is good or bad or whatever. Just present whatever you need to present. It is yours. It's been accepted. So present it the best way you feel, because you are the one who experienced it. You are the one who did this work. So you know it better than everybody else. But as I said, you can ask your colleagues to just have a look at it before you present it. But David, please go ahead.
Yes. Thank you. Thank you. Rightly said. And to answer those questions, the first one around a team to review the presentations after abstracts have been accepted, that can be done. We have the scientific committee who would be very happy and ready to provide some support. But remember, the work of preparing the slides belong to the authors. It's not the scientific committee to do it, but they would be able to review and guide and provide some kind of support depending on what issues probably are raised. So, and even in the abstract writing, if you have the first draft, feel free to share with Kehpca, and we'll be able to direct the draft abstracts to certain people, members of the scientific committee, like I said, would be able to work with you and just guide you so that your abstract is well done and, again, properly submitted. So would encourage people to keep writing and share. Remember, the deadline for submission for abstracts is on the 30th of this month, so we have about 2 weeks to do that. I don't know whether we'll have an extension. I can't commit for now, but we have about 2 weeks to submit the abstracts or share with Kehpca for support. Just on that, in terms of answering the second question on incentives, in conferences, usually there is, awards and rewards for sort of best abstracts, because we cannot reward everybody that submit abstracts. But top-notch abstracts and presentations, definitely there will be recognition, and I may not be able to say what it is that will be given to those people. I know you asked about registration. If say, for example, you feel you have the best abstract and you would wish to be supported otherwise, I don't want to say it's a closed chapter. Write to us, reach out to us. When we have some support that we are able to, definitely we'll get back to you and affirm with either a positive answer or depending on how things go. We are fundraising to be able to get many delegates participate, but as it now, we cannot commit much in terms of supporting people, but there is some goodwill, and so depending on the different people, we'll be able to provide very specific kind of answers to specific needs expressed. I hope I have answered you, Emmanuel. Any other question?
Thank you so much.
You're welcome. Any other person who has a question or a comment will be ending in the next 3 minutes. Do I see Josephine's hand up from Kehpca? Okay, so thank you, ladies and gentlemen, for participating, and I hope we've learned. We plan to host another webinar next week, probably on Thursday or on Friday during the late afternoon from around 3:30. I don't know whether it's late afternoon or early evening. So that the people that would be able to, could not be able to join in the evening at this hour can also benefit, and we'll plan to have it with a bit of practicum, sort of like the case studies that Robai did would be able to, sort of make it a little bit more practical with more questions targeting the audience, hopefully, so that we are able to make it very simple and easy for everyone. And so unless there is an announcement from the Secretariat or anyone, Dr. Robai, we are grateful for allowing us your time and sharing and giving us knowledge on abstract writing. And I hope we learned and people have seen that it's not difficult to make abstracts. We look forward to meeting you in Kisumu, but before that, having the many abstracts. We will be reviewing them in the month of July and then provide feedback so that people start to prepare their presentations. So registration is open through the portal. Again, abstracts will be submitted through the portal on the conference website. It's easy. You just need to register with your email and names, and then it will send, the system will send an email or else a confirmatory email. Then once that is done, then you're able to submit your abstract. In case you encounter any challenges, please reach out to us. We will be able to support. And so the conference website has been shared by Dr. Mwinga on the chat. And so at this juncture, I would like to invite Makiline to close for us. Thank you, Kehpca team, Emily, Paul, Josephine, Mark, Miriam, Dr. Mwinga, for being really key in terms of making sure this is successful. Everybody else, we wish you well. Good night and God bless you. Over to you, Makile.
Thank you so much, David, for such a great session, and bye for accepting to take us through the abstract submission session and way. We're really grateful for your time and the expertise that you've shared with all the members. I also want to thank all our members and our colleagues who were able to join this session. We are looking forward to having you in Kisumu. You know, it's been quite a long time since we had the last Kehpca conference, and through COVID-19, I'm sure we went through a lot of learning. So we are really looking forward to your abstracts. And as David has mentioned and Dr. Robai, if you have an idea and even if you have challenges writing an abstract or putting it together, please just get in touch with Kehpca and we'll be able to help you or link you up with one or two people so that you're able to share your experiences and to share your learning during the last 4 years. So the Secretariat is working very hard to ensure that we have a memorable conference, and we are looking forward to having you and even people from the region, people from so that we can all share our experiences. And we look forward to seeing you there, and have a good evening. Thank you so much.
Okay, good night and bye, everyone.
Bye, everybody.
Bye.
Good night.
Night.